Welcome, everybody, again. It's so lovely to have everybody here. I am thrilled to welcome you all to the first Alumni Spotlight, the Conlead Alumni Spotlight of the 2025-2026 academic year. My name is Anita Verna Crofts, and I have been teaching with the Conlead program for 15 years. And as part of my work with this wonderful graduate program, I have the privilege of engaging with the alumni population. And what we'd like to do today as we move into this conversation around the intersection of health and communication is first and foremost invite you all, if you're joining us here in the Zoom room today, let us know where you're calling in from. We'd love to hear a little bit of what drew you to this topic, and that chat is open. Please use it. We will be also using the chat as a chance to put in information for those that are attending this conversation. And so as you listen to these illustrious alums in the panel today, please feel free to drop Q&A questions in the chat, because I will be helping facilitate the chat in the latter part of our hour today as the Alumni Spotlight. And as I said earlier, this is one of my great joys as affiliated with the program, as I get to work with our broad now global alumni population. And the Alumni Spotlight is a program that launched last year and was very much the vision of a subgroup of our alumni called the Conlead Alumni Fellows. And the Conlead Alumni Fellows are a small cohort every year that look to bridge the Conlead alumni population with both the student population, the alums at large, the faculty at Conlead, as well as the broader community. And so it is exciting that today, as part of this Spotlight series, where we identify a theme, we convene alums from the Conlead diaspora who have expertise within said theme, and then there's a Conlead Alumni Fellow who facilitates it. And it is my true pleasure to introduce Chiquita Wright today, who is a Conlead alum and a Conlead Alumni Fellow, and who came to me with a real interest in hosting a spotlight that looked at the intersection of health and communication. And I was thrilled, because I know that we've had students that have come through the program where their interest in deepening their professional communication expertise aligns with the larger world of health communication, healthcare, wellness. And so it is thrilling to me that we get to have this conversation today, and that Chiquita will so expertly facilitate this conversation for the first part of our hour together. And as I said, then you'll get a chance to hear from all the panelists. Chiquita will engage them in conversation, and then I'll come back at the end and help facilitate a bit of a Q&A before final words from Chiquita to close us off at the top of the hour. So again, the chat is open. Please introduce yourselves. I will be monitoring it for questions. You can ask questions via the chat. Drop them there at any time during these four conversations with our wonderful panelists, and I will be looking at those and then bringing those back into circulation at the end of the conversations that Chiquita engages with these four. So at this point, I'm going to turn it over to Chiquita. Thank you so much for hosting us today. It's thrilling for me that we get to have this conversation, and I turn it over to you.
Well, thank you, Anita. I appreciate that warm introduction, and welcome everyone for joining us today on this conversation on healthcare and communication. And I want to personally thank Devika, Kool, a UX designer with CVS Health, Yirong, Wang from Digital Communications Associate at Selfhelp Community Service, and Alina, Kaiser, a social media manager at Alignment Health, and Jennifer Mai, a research scientist at Harvard studying to cure cancer, for joining us today and sharing their expertise. I am looking forward to this conversation. And as an alumni of Cohort 22 from the Conlead program, I'm excited to be here. I'm a little nervous because it is the first one. So obviously I got the jitters, so bear with me this morning or this afternoon. Personally, as a mental health advocate and a caregiver for my younger brother, I've seen both personally and professionally, both sides of the healthcare world. So bringing this conversation today means a lot to me, so we could be able to hear what these alumni fellows, I'm a little nervous. So again, I'm gonna be very human with you guys, and I'm gonna mess up, so bear with me. But in my current role now as a youth development professional and previously as a development communication associate, I've seen what and witnessed firsthand when healthcare communication can bring families closer together and then move them further apart when it's not lacking and when it's not really there to be able to have that transparency. So our outstanding panelists today will bring their unique perspectives and adapt to adapt to the changes where they're seeing in the world today, especially with our current administration, especially with the shift in their impacts in organization and the grants and things that we are able to access, whether you're in a nonprofit atmosphere or if you're just in a regular day-to-day working. So I am, again, going to thank you guys all for being here. I'm going to swallow my words a little bit and calm my nerves, but I'm going to kick it off with the first question. And I want to start with Yirong Wang. As I mentioned, she is the Digital Communication Associate at Selfhelp Community Service. So with that being said, Yirong, can you tell us a bit about your role with Selfhelp and why your work matters to you?
Sure, of course. Thank you, Chiquita, for introducing everything, and also thank you, Anita, for the opening, and thanks to Cool for inviting me to this event. My name is Yirong Wang. I'm from Cohort 20, and I graduated in 2022. I'm now in New York City and working as the Digital Communications Associate at Selfhelp Community Services. Selfhelp is a nonprofit organization providing the home care and also the community-based programs for the older adults in the New York area. And for those who are not in New York area, we have the online community called Virtual Senior Center to provide some online connections for them to meet friends or build connections. And what I'm doing now is mainly managing our social media platforms and also the ads platforms, including marketing research and analytics, and also collaborating with other departments to create the campaigns to promote their events. We have some like independent events and also some fundraising events every year. So they need to need some maybe social media content or the ad promotion to create campaigns to promote them. And I'm also helping my managers and the colleagues from other departments to deal with some daily projects. So that's also very small parts of the daily work. And why this work matters to me, since our clients are mainly the older adults, I have to say previously I've never had a chance to access this part of this group of people. It's very different. Like previously, I only had a chance to meet with the like the younger generation or the dealers, businessmen, but the older adults, this group of people is my first time to meet with. And it's very interesting to see them in a different angle, like when I transform down information that will benefit them to them. So it's a very new experience for me in my life. And also when I see them, they give me a kind of familiarity because my grandparents they are very far away from me, and seeing them to have their benefits and also meet their friends in the community is give me a kind of different feeling. And sometimes I'll think about because the aging lives now are very different from the past, and I'll think about my parents' generation, their aging life, our generation's aging life, and maybe younger generations. So sometimes I might think about these things, and I think this is also this job, this role brings to me. In law, it's a very vibrant and very interesting role to do every day, and I really like it.
That's amazing to hear because social media is a very big part of the world today. So I want to ask
Yes.
you, when managing communications for a community-based healthcare event, how do you ensure messaging builds trust and encourage meaningful participation across diverse audience, especially the elderly community?
Sure. So for this question, I think the events now can be divided into like in-person and online events, especially after the pandemic. And also for the older adults, it's very new experience for them because before they only meet their friends in person daily, face by face. So if I have this question before, I might think about what they need most because they are still the client, the target audience. We need to consider their features when give some information to them. But now I realized, especially after I came to New York City, I realized that the basic of messaging is the language. Before I was in, whether it is I was in China or I was in Seattle, like Chinese and English only a language to transform this information. So when build all the information and messages, I just use this single language. But after I came to New York City is a pretty diverse place, and everyone comes from the different backgrounds, speak different language. And I'm not kidding. When I walk on the road, I can hear at least 5 languages around me. So consider this element like in-person event. I my colleague and I joined at the beginning of October. And this event was in Flashan. So most Chinese live in Flashan, and my colleague speaks Cantonese. I speak Mandarin, so it's very easy and efficient to explain our services or the programs to them and in their preferred language. So they will have a kind of familiarity with our community and I'm willing to learn our organization or the services. So not only in Flushing, we also have some programs in Brooklyn who mostly speak Russian, and in Bronx speak Spanish, and we have different we have employees speaking like multilingual or bilingual. So it's very easy to communicate with them in their preferred language. So first I might think about language now, and then I'll think about how to attract them and what they need from this information. So like for the online events, we don't have a very specific online event because older adults still want to meet in person. But we do have an online community to have the courses and different classes for them to learn something new and enjoy the music and art. So we do the weekly newsletters. So we'll put the new classes and also the new partnerships at the top so they can see it at the first sight when read the whole newsletter. So this is also the part in this process I'm thinking about. So in all, I still think like older adults are very uh, maybe easy to join this kind of I like to say loyalty program. Like once they found that it's efficient or the information they get from us is useful, so they are very easy to join this community because they already have friends there. So yeah, that's what I'm thinking about this question.
Oh yeah, that's pretty awesome. I hear that a lot when it comes to the elderly community that they need to be in person rather than online because of sometimes that barrier is not necessarily always offered to them. So I do want to switch it over and ask Alina a question. and that way that she can add a little bit more to it, just because she is also on the Medicare side when it comes to things in that nature, when it comes to our well-being. So Alina, can you tell us a little bit more about your role at Alignment Health and why your work matters to you?
Yeah, hi. Yeah, thank you so much for having me. I'm really excited to be here. Yeah, so I lead social media strategy at Alignment Health. We are a Medicare Advantage company. We're focused on doing Medicare Advantage the right way. So we aim to put seniors first in everything we do, from our clinical operations all the way to my role, which is social media manager. And I mentioned that kind of senior first mission because for me personally, that's what brings a lot of meaning to the work that I'm doing. I feel most fulfilled when I'm working at the intersection of communications and impact. And so I have this unique experience in healthcare that I haven't experienced in some other sectors that I've worked in, that I'm able to see this direct impact of my work and my team's work that we have on seniors and our members, which feels good.
That's awesome. So the question I have for you is that given that Alignment Health 2026 plans aim to reach more Medicare eligible adults across multiple states, how can you communicate strategies being tailored to reflect the unique social, economic, or health disparities in different communities? Like examples, rural areas versus urban, low versus high socioeconomical statuses and things like that.
Yeah, it's a great question. Working with folks across many different social and cultural and economic backgrounds, to me, means that we need to connect with people on a human level. And so I'm thinking about like, what's the story that can resonate with someone in LA, a market that we serve, as well as someone in rural Nevada, which is another market that we serve, very different places. We've got a team that works on like direct member communications and segmentation, but my role on our corporate communications team is really meant to be, that role that connects our brand with diverse audience of like seniors as a very diverse audience across these different markets. So I think about it in terms of kind of those common challenges that seniors face and some of those unifying experiences of aging. So like how our team and our health plans might address that, for example. Something that comes to mind is every year for the last 4 years, we've put out this national survey where we ask seniors in America, it's kind of looking at social threats to aging well in America. And for the last 2 years, seniors have shared that their number one threat to aging well is their ability to age in place, which really just means like their ability to stay in their own home as they age. And what's interesting about this is it's the number one concern for people across those sociodemographics. It affects everyone, basically. So in our storytelling on social, I am able to leverage that to connect with our audience through multiple different themes or avenues. I can share about our in-home care program that's kind of designed to keep people in home and support their ability to age in place. I can share about our caregiving benefits that give seniors access to a caregiver of their own, or might reimburse their family members who are caregivers, who act as like a family caregiver. And then with that kind of like data-backed story, I'm able to feel confident that I'm hitting a chord with our audience that resonates across those different markets, because this is a challenge that we've researched and seen that everyone across these sociodemographics experience. So I've done some lo-fi video interviews with our social workers, and we call them our Care Anywhere team. Like, so they're the people who go into the home. They're the physicians and nurse practitioners who go into the home. And I've done lo-fi video interviews with them to really build those authentic connections between them as the service providers and then members and prospective members, to put kind of a face and a voice behind the benefit that spans this demographic. So it's kind of a long answer. So to wrap it up, I feel like it's cool to be at a company where I get to see the behind the scenes of how deeply our whole team cares, and then get to build those social content strategies that bring that authenticity to our social in a data-driven and meaningful way.
And as a transparent person, authenticity is very important no matter what age you are. So I do have another question for you, because as government policies and community needs continue to evolve, especially around affordability, access, equity, and mental health, how do you approach adapting your members' engagement campaigns so they truly reflect people's real life experiences while also meeting compliance requirements? Because I know that you mentioned that you have did interviews with social workers and some for low interview for impact there. Could you elaborate a little bit more on that?
Yeah, it's another great question. I will say the the interviews with our own team are much easier than the interviews that we might want to do with members, just because of those compliance requirements. So, when we're like talking about real life experiences, it's our members that have those lived experiences that we're actively building the solutions to address and serve those things. And so we have members with chronic conditions and life-threatening medical experiences that really are exacerbated by policies and access to care and economic pressures. We're focused entirely on that senior population, and it's a very vulnerable population. We'll have members email us some really heartwarming stories about like how we've addressed something that they felt was impossible, or like their old insurance company never cared the same way, kind of thing, or something they never thought an insurance company would do for them, and then we've done it. And from a communication standpoint, especially from a social media standpoint, these stories I feel like are gold, but there's this other layer of complexity when you're dealing with members' protected health information. So they're sharing this in an email format with us, but it's not that we have permission to just like share their story. So there's HIPAA compliance on the one hand, and we've got our whole process to go through to be able to share those stories in a compliant way. And I don't need to get into the details because that's just process, and I'm sure every healthcare organization has their own. But there's also, on the other hand, regulatory compliance. And as far as that goes, if I want to talk about, like, for example, a specific benefit that supported a member through something, in one of those stories that they shared over email, I have to be careful that I'm not positioning it as marketing, because we've got strict seasons when we can kind of market our product or benefits. And so that content would have to be filed with the Centers for Medicare and Medicaid Services first. So I would say it's a lot of balance and planning upfront earlier in the year, gearing up for what season, or what stories we want to be sharing in that kind of AEP season, getting our HIPAA compliance things in order. And all of that takes time and planning, of course. So then I think about, on the other hand, like, what are the things that I can do to bring some of that that member sentiment, member testimonial sentiment through to just kind of a regular cadence. And so one thing I do is we get a lot of really great Google reviews. So I just kind of skim through those every week, and I'll pull out the standout Google reviews that maybe strikes a chord with members, or with seniors as kind of a demographic on their own. And I'll pull those out on our social media. So it's really about balancing those bigger moments and higher production stories that really cut through at a critical time of the year for us, with some of this content that is kind of a steady drumbeat of continuously reminding seniors that there are others out there who have similar experiences and who are having, their concerns resolved with us. So it's a nice way to set us apart from others at a time when there's a lot of mistrust in our industry. And I would just say, like, who better to tell our story than our members? So
that is amazing, especially that you called out the mistrust in the industry when it comes to communication and things like that. So thank you so much for answering those questions for us. And I want to move on to Devika. Devika, and just ask her a couple questions really quickly. Devika, can you tell us a little bit about your role at CVS Health and why your work matters to you?
Sure. Thank you so much. Thank you for having me here. Hi, I'm Devika. I'm cohort 20 and I graduated in 2022 with MCDM degree program. So I'm a designer and a digital creator, and I've always been that, right? But Comlead really helped me to transit to the role of a UX designer, and I'm really, really thankful to our professors and the work that I've learned there. Prior to CVS, I worked at Google and Walmart as a UX designer itself. And my switch to the healthcare industry happened for a reason. I was working in the accessibility team at Google, which helped designing accessible products. I even wanted to be closer to this industry, hence CVS Health. So in my current role at CVS, I work on both internal and external products for both the CVS and Aetna. The internal products are from like mostly from, I don't know how many of you know about PBM line of business here, but like pharmacy benefit management line of business. And I'm also like focusing on like data driven tools over here to make them incorporate with like AI and make it smarter. And additionally, I'm also working on other projects which support nurses and managing inventory, medical inventory at hospitals. So it's like a very high impact project in general, um, which helps ensure that patients receive right kind of supplies, and also it helps the business needs because you're maintaining inventory and not wasting any kind of resource there. Um, so I'm involved. The interesting thing about I read in the chat someone mentioned that they wrote a paper about like AI in health industry. That's very exciting. I would love to read that because I'm also like focusing on a lot of projects over here as a designer where I can incorporate AI in a most seamless and ethical manner. Now, why this role is important to me is because like mostly think that like healthcare industry in general, wherever you work, isn't like a luxury. It's a necessity because when I see people struggling to get the help they want in the healthcare special matters, like it really hits me because like at that point in time they're not in a right state of mind. They're struggling with a lot of other things. So why to make their life even more difficult by those unintuitive tools, right? So that's why I wanted to work in this industry, and here I'm at. I'm working here. So yeah.
Oh, that's awesome. And you're right about that. Healthcare is definitely something that is going to be continuous throughout our lives and way past that. So I do want to ask you, so healthcare often involves balancing business goals with patients or user needs. How do you communicate users' insight to decision makers to advocate for more human-centered, accessible product design?
Yeah, that's a really good and tricky question. That happens like a lot, right? Like that, the striking a balance is really important. So I feel like in healthcare industry, especially, I have learned over the time that storytelling is even more important. Like striking data with research, which is very powerful, but like stories that humanize insights even more than data. Like you connect with people, and again, I'm emphasizing on it that this is something I've learned in Comlead again. Like storytelling is a very, very impactful tool that you can learn. And then as a designer, it really helps you. Why I'm saying it is because like when you show in terms of design, best of the designs, best looking designs to the stakeholders, which takes less time, which is resourceful and whatever. They don't care until you tell a story and tell them why it's important to the person who's making it, or who's going to be using it, right? So what I what I also do here, so I work as a researcher as well over here. So I conduct research with people. I like to take those snippets. I like to take those quotations. I like to tell them that this is not what I think, this is what the person who's going to use think, right? So that kind of narrative really helps them connect emotionally and not just logically and from the business point of view, right? And I feel like it is very important in the role that I am in, especially because the stakeholders that I deal with are underwriters, are contractors, people who are not from the design background, who are not probably like you need to like talk to them and get like make them understand where I'm coming from, right? I also like to translate these user needs into like business outcomes. I believe that as a UX designer before, when I started my career, I used to focus a lot on like how my design looks like, my rationals and stuff like that, and not talk the business language. But I've realized that that's a very big shortcoming in a designer if you don't do that, because like you will not be involved in the bigger conversations. Then you will be just like somebody giving designs and like a upper level thing. So showing how your workflow can save time, improve, prevent errors, how much money will be saved, what is the ROI will look like, how is it tied to efficiency, all of these conversations really, uh, it's a shared goal rather than a trade-off. You need to show them that. And I think it's something that all of us designers can relate to, that finding ways to make empathy actionable is something that helps us all at all times.
I like the way that you said that, finding ways to make empathy actionable. I think that in the healthcare industry, you don't find a lot of UX designers or even social media managers and content creators and things like that that's actually showing empathy and showing that, like, this is something that's happening to a person and it's real. And so to be able to incorporate that and not just as a business is very important. Thank you so much, Devika. So far, you guys, thank you guys again for joining us. We've heard from Yirong, Alina, and Devika on communicating through various channels like social media, UX, web design, and other means to communication. Our final panelist, Jennifer Mai, approaches healthcare communication from research lens. So I would like to ask her a couple questions really quickly. So Jennifer, can you tell us a little bit about your role at Harvard and why your work matters to you?
Sure. Hi, everyone. I'm Jennifer from Cohort 17 and the MCCN track. When I graduated from ComLead in 2018, I thought I was going to be a full-time drug dealer, pharmacist that is, and bringing to life what I explored during my time during ComLead as reimagined community pharmacy spaces to have more conversations around health. But unfortunately, without government support of paying healthcare workers better, these spaces are currently diminishing across the US right now. Bartell Drugs in Seattle is gone. A lot of well-known brands and chains across the US are gone, as well as community mom and pop pharmacies are starting to shut down as well. AI is replacing these physical spaces and person-to-person conversations you could have with your provider from present and future communities. So anyway, I learned foundational content strategy during my time at UW. And then during the pandemic, I got my certification in health communications at Stanford. And then I finally sought out the rigors of Harvard to learn and engage with the content that was missing in my cancer research and dive full-time into being a drug maker with my research work. My cancer research is something that I've started since 2012 until now, and I've weathered every storm that comes with it. I developed a cancer drug during my time in Seattle's community colleges with a shoestring budget, and I would go on spending the next decade trying to understand it, to communicate about it, to finesse it. During my time at ComLead, learning about UX design really opened my mind to human-centered design research and to truly empathize with people as you create something. Those UX class assignments, I collected stories from all kinds of people on what kind of drug route of administration they would like and envision in a new cancer drug. And the consensus was away from IV and something probably like an oral or patch format. So I got to work on the concept at Harvard. And making an oral format drug isn't hard. What's actually hard is the dosing design, since to effectively beat cancer, you need a high dose of your drug. And that isn't feasible making patients take dozens of pills from a UX standpoint or viable from a pharmaceutical adherence concept. So I had to look into molecule grafting and making your drug stronger, but still compact. So I've been working on manufacturing guidelines at Harvard. The drug works, the emerging patient data is really exciting. And now it's about getting it through the steps to get it FDA approved and hit the markets. For why the work matters to you question, my research work has always been about reinventing the wheel with cancer treatment modalities. And for the longest time, it was the holy trinity of chemotherapy, radiation, and/or surgery as your only options. And then along came a new class of drugs in immunotherapies that sought to modify the patient's immune cells and re-inject them back into the patient as a communicated concept of personalized medicine. I recently had a dear friend whose father passed away from lung cancer a few days ago, and she allowed me to share her story. When he had less than 2 months left to live, the doctor suggested immunotherapy as an option. Is it personalized medicine if it costs hundreds of thousands of dollars, a 2 to 3 week turnaround time for your cells to be modified so that this patient could have maybe 1 or 2 doses before death? It's only an option if you even live near a biotech company that can perform the procedure. And if you're in a rural area, this is out of the consideration. And the drug only barely has a 30% chance of any kind of effect. So for me, I sought to communicate into my designs what personalized medicine would be. It's hearing endless stories from real patients of how different and variable each patient develops cancer. There are infinite ways to get cancer. And so designing a drug that effectively works on all cancer types so that it does not turn away patients, but is a lot kinder than chemotherapy and radiation, yet affordable, was sort of the challenge and marathon I signed up for. And it's also part of the class of drugs I'm a part of as well. It's called targeted therapies. And the goal I wanted to contribute is another option in that cancer treatment triage. And it's sort of also what my industry has finally caught up to. What I already knew back in 2012 was that major pharmaceutical companies finally now are moving away from chemotherapy and radiation and finally agree with patients and clinicians that as a whole industry, we need new drugs that are kinder and more effective. And I've heard from major pharmaceutical CEOs that cancer and its death is coming for all of us if we don't move away from classical insanity in drug designs. So repurposing chemotherapy in many formats as possible is no longer effective. Therefore, it's about hearing the pain points that patients bring up about their cancer drugs and pharmacology problems, hearing the pain points of pharmaceutical companies about new drug designs to target cancer, and then addressing all of that in research, design, and storytelling.
That's amazing. I actually am a very big fan of yours. That's one of my dear friends here. So I do want to ask you, because your background is so unique in research scientist and developing this drug for cancer, and also been a very good communicator. What kind of health content do you prioritize sharing to today's often polarizing environment, proactive, reactive, educational, and crisis related? And do you consider or anticipate how audience might respond as you create it? And more broadly, sorry, it's a lot to throw at you. How can we better protect and support the mental health of those working across all areas of healthcare during these challenging times, and also utilizing the cancer research and drugs that they need to take care of themselves?
All right, it's a three-part question. So let's go with the first question around content. In my work with drug development, I'm actually not allowed to publish anything pertaining to my own work personally until the drug reaches the market. But I do participate in education on crisis-related responses to health content around cancer and drug development. I talk to people and fill in the gaps where they might have regarding health topics and concepts. I recently saw a viral infographic that circulated on the internet that communicated Tylenol isn't a or the drug, but acetaminophen is, with a list of drugs that contain acetaminophen in some form. I had to correct it. Tylenol is the drug. It's the brand name, original name, patented name, innovator name, and acetaminophen is actually the chemical name or generic name once the original patent expires. And within the word acetaminophen has some context clues about its chemical structure and drug class. So drugs that contain acetaminophen and another substance are actually completely different from sole agent acetaminophen. So that whole articulated list missed the communication mark. And then I was put on record, cited my organization. So I had to make sure the information I put out there was authentic to my professors at Harvard Med, because this kind of stuff goes viral really fast without a chance to properly edit it. And then for your second question, I think how someone presents the topic to you, you can kind of gauge from context on how to respond. And I try not to be reactive, but to educate, like in informed consent situations. I may not change how you operate, but I can hopefully give you enough information to make informed decisions. And I've had plenty of experiences in this realm discussing COVID-19 vaccines to the fallacies of cancer vaccines. And for your third question, I find that antagonizing cancer, stripping away critical funding from researchers, clinicians, and hospitals does not make the disease go away. It's supporting every part of this community in any way that you can, talking about cancer, demanding better treatment options, rejecting cash grabs every treatment, donating to research, advocating for federal funding, supporting the mental health of everyone in the industry. Every day it's a new challenge for us, trust me. For me personally, there are times when I've had to step away from an inhumane cold shoulder by leaning into community with fellow colleagues who can commiserate, coming up with creative solutions to still get to your personal goals, taking self-care breaks, exploring arts, music, support small business, cooking, donating resources to community needs, spending time with your pets, adopt a shelter pet, checking in with your aging parents, neighbors, friends, pick up a book, watch a new TV show, or movie, and getting professional therapy help is really important during these times.
Well said, very well said. I wish we had more time to go into more details about your work and communicating, but I want to open up the floor to all the panelists and ask a question. And it's kind of long and lengthy, but as more people turn online for their health information, how do you approach creating and curating digital content across organizations like Selfhelp, CVS Health, Alignment Health, and through your work as a researcher, Jennifer, to ensure key resources such as behavioral health materials, social service tools, and interpreter access are easy to find, culturally relevant, and trustworthy? And how do you navigate challenges like digital literacy and access gap while doing so? I know, Yirong, you mentioned that earlier on in the conversation, and things like that when it came to access, especially with the age gap. I'll let you guys unmute when you guys are ready to answer the question.
I'm confirming if it will go with me. So in my role and also in New York City, I through the work experience, I really think whether it is New York State or New York City, they really have a very complete system for not only Asian but every different community, because they also have the community for art, cultural, everything. So and also the NYC agent and NYS agent do funding and do give funds to most of our programs. So if they have some new information and also some new benefits that the older adults need to know, they will put this information everywhere in different language. So these older adults can see the news. And to assure that everyone can see it, they will also put this information to us and also other older adult centers belong to other organizations. And we also have the newsletters and also the online media, and also have the because they the older adults prefer something that can be seen directly. So we also have some printed flyers and the paper newsletters for them to read. But I found that this summer I had a chance to went to our older adult centers. I found the older adults really catch the new trend. Like they get used to the new devices, whether it is phones or the iPads or the laptops. They also get used to this new new trend to interact with the information they need. So they are not waiting for the information comes to them. They also go for this information. So that's also the thing I found this summer.
Devika, Elena, or Jennifer, do you guys have anything you guys want to add to that question?
Yeah. Oh,
Go ahead.
you go ahead.
All right. So I recently saw a great post on NPR's social media recently called "Not Sure How to Support a Friend with Cancer. Survivors Have Advice." And they offer 4 really great suggestions sourced from real stories, translated into communicable advice. Our job as communicators is to take something that's tough to communicate and make it communicable for the intended audiences. And so I take patient pain points and communicate into a drug design. I take pharmaceutical industry-wide pain points and communicate on how this drug hits their wish lists in wish list targets in cancer. I definitely live in the Stone Age using no AI, actually, only thousands and thousands of library research hours across Harvard and MIT to make sure that the narrative is as accurate and as trustworthy as it can be. And if those 2 libraries don't have what I'm looking for, which has happened, I ask colleagues from other universities, like friends at Chapman University, for a library loan instead of turning to AI. So I really live and breathe my degree communities and networks.
That's awesome. Elena, do you want to go ahead and?
Yeah. Yeah. So one thing that comes to mind, at Alignment, we've got this closed private Facebook group for our members. And it's a way for them to kind of ask us some direct questions, have that one-on-one connection. What I've also seen as I manage that group is it's like a great place for them to connect with each other. And so it's kind of this community building thing for them. And like, you know, loneliness, going back to my social threats to aging well in America report, loneliness is a huge threat to aging adults. And so it's kind of cool to see our members relying on each other, asking about plan information and specific health information and health tips and how do you handle these different things. But my role in that, in making sure that people have the accurate information, is that if there's a member asking about a specific health plan, like does my health plan benefit cover this specific thing, I try to be as like applicable to all of our members because they've got multiple different health plans and benefits vary by plan, all that kind of stuff. And so I will aim to answer that question, but then apply it to, you know, anyone else who's kind of lurking and seeking and who might just read that answer and take it for themselves. That's one thing that comes to mind about just pointing them in the right direction for the information that they need as they're like going online more to access it. But we've also got a team of people who's doing that direct member communication. And that's not my role, but I do amplify that content, and I focus on kind of building trust and getting us seen as this reliable source for our members to turn to, so that then when we've got these, you know, maybe a new website update, we're able to communicate that out a little bit easier to our members in some of these social first ways.
Thank you, Alina.
Yeah. So I was just listening to everybody, and it is such a good thing to have your insights in from different backgrounds. If I were to say it in like a from a designer researcher perspective, because I do not work as a social media marketing in a social media marketing role, I feel that two things: trust and transparency are very, very important. And I've realized it, especially because of this whole thing about like using AI everywhere, right? People are vulnerable, people are scared. Like they are somebody who are working in the company since like 30 years, right? And they are scared because they can't learn new things easily. They don't know what's happening around them. They're just like, so scared. So whenever we as designers go and show something to them, which is like, say, which has a difficulty of digital literacy, you don't know what it is and how it is happening and what, they get scared, right? And the hesitation is always there. So what I feel, and I do it like diligently, is like uh, involving them at all points. Meaning, like I don't work at a hospital. I don't know what they call, like what is their vocabulary like. I might design it in a way that might be the best UX design or the best language as per the UX terminology trends, but that might not be something that might be Latin and Greek to them, right? So what I do is, like, even for like simple tables that have like data, I meet them like weekly, literally like a focus group that I work with, and I ask them individual questions about like, what do you think it means, what do you think it should be. And what happens, two things happens in this way. Firstly, they're aware of what's coming, they know what's coming, and they know that it's not going to be harmful, right? There's full transparency why we are doing this. They can ask questions because you become friendly when you meet people like on regular basis. And then eventually they also know that they are building it with us, so the accountability is like on them as well. So that means that the acceptance level will be automatically higher, right? So as a designer, I try to do that, like even for like external products for Etna, what I was saying, like there's a group of doctors that I meet. I don't understand them, they don't understand me, but I try to like somewhere come in between and understand what they want, right? So it's really about like who you're designing for, what they want, and that's it. And just being transparent, that's what I think.
Awesome, ladies. Thank you so much. It's been a very powerful and short conversation. I really do wish we could get more deep into it. But some things that we've learned and took away so far is that accessibility and language equity is very important with communicating to no matter what the age group is. Authenticity and communication, regulatory compliance is something that is very good to keep your head about when you're actually navigating the world, because there is a lot of distrust in the industry. And with that comes that trust and transparency and deep research that is necessary for when we're communicating stories from not just our perspective, but others. And having a safe space to communicate. Elena touched on that by mentioning the group, the private group that Alignment Health have with their providers. And then also loneliness in aging adults and mental health is something that's very real and something very passionate that I'm passionate about. So I definitely understand what that is like. So with that all being said, I would like to pass it over to Anita to keep us updated.
Chiquita, thank you. And we'll be hearing from you. At the end, I want to echo everything you've just said in terms of gratitude for these 4 panelists. And I've just learned, even though we only have an hour, I feel like my brain is buzzing with all that you've shared. And I know that I speak for those on the call as well. And we'll take a little bit of time here as we move to the top of the hour. There are a couple questions. I'm going to take Ali's excellent question that was more specific to Alina and Yirong in terms of the older population and asking about how over the next 5 to 10 years, I'm going to bracket it as 5 years, the way things change in terms of communicating and how we engage our publics and our constituents and clients changes so rapidly. 10 years, a decade in the future feels almost like an impossibility for prediction. But I'm going to take Ali's question that was targeted specifically at how, as the older population generationally shifts, and we know certainly in this country, there is an enormous demographic bulge in terms of the aging of this country. But I'll open it up for all 4 of you. We'll start with Alina and then move to Yirong on the question that Ali posed about how are things shifting in terms of the way you might imagine communicating with your particular client base. In the case of Alina and Yirong, that you're seeing this expansion of the demographic that you serve in terms of elder care and elder population. And for Jennifer and Devika, I'll just ask that we expand this question to imagine what are potential trends you're seeing that might shift the way you communicate with what I'll call your target audience broadly. And I'll leave it up to the 2 of you to decide which target audience you want to talk about. But this is a question that asks you all to be futurists of a sort. So how you see things changing over the next 5 years in the way that you might engage and communicate with those people you choose that you're aiming to serve. So Alina, would you like to kick us off, and then we'll go to Yirong, and then maybe we'll hit Jennifer and then end with Devika.
Yeah, sure. Thanks. Yeah, it's a great question. I think about it in terms of like, we see so many social media trends and things that come and go. There is always a foundational piece. You always have to build trust with your audience, no matter like how things change in terms of like channel, or like where are seniors hanging out more online in 5 years versus now. Those things will change, but it's always going to be about building trust. And I think that that'll look different for all this AI conversation, like it's going to look different how we build trust with potential members and seniors. But I think a lot of it is kind of foundational. What I'm trying to say is a lot of it won't change, in my opinion, and a lot of it will. But like those things, there's like a layer that you have to have that. And I think that's the bit that stays the same. And the things you build on top of that are what'll change. No vague.
Thanks, Alina. What do you think, Yirong?
Yeah, sure. I agree with Alina to some degree. I think like for the 5 to 10 years, or maybe in the more future, it's very unpredictable. If it's maybe 3 or 5 years before, I might say it's predictable and it will go like this mode. But now with the economy, and for us, we also have the federal government funding. With the government shutdown, it influences us a lot. But if maybe for 3 years in the future, I would like to see it might still go on in the current mode, because people still in this community, the very basic thing doesn't change. They still communicate with each other in different methods, and they also try to get used to the new trend. So yeah, for communicating with them from our perspective, it still depends on how they communicate and with each other. So in their ways, we can like still build the kind of trust or connections with them. But for 5 to 10 years, I think it's very unpredictable.
That's very fair, but it's always an interesting exercise to try. As a little sidebar, some of you, all of you are alums of our program. Some of you may have taken Rob Salkowitz's The Future of Marketing, but that's a class that asks to place yourself or place the context of how we might market to populations deep into the future. And there's something really invigorating about those kinds of imagination exercises. So I appreciate you all taking a chance here to spitball a little bit. Jennifer, how about you?
So for me, that's something I kind of live a day-to-day practice. Like every 5-year blocks, something different happens. And every time I communicate with senior patients about what my drug does or is proposing to do, they give me feedback that I actually get to incorporate into my designs. I know that they don't want to take a lot of pills. They don't want to take multi-step treatments or dosings. Like they don't want to do morning, lunch, and dinner. They want something more finessed. And I have to go back to the drawing board and redesign my drug dosing based on things I've learned. And as the aging population grows, I find that more patients want to learn every detail and facet about the drugs they're taking, like true informed consent knowledge. They want to know the ins, the outs, the side effects, the affordability, and what this drug looks like long term, why they should take this drug versus sticking to chemotherapy and radiation versus not. So it's things that I've had to consider far out in the future that you don't think about at bench research phases, but you do.
Right. Thank you, Jennifer. And last but not least, Devika.
Yeah, it's a tough one, Anita, to end. Okay, so I think I think that over the next few years, I feel that communication is going to become very, very contextual, assistive, and emotionally intelligent, because we are already seeing in the world of AI, in the conversational interfaces. Like if you talk about like technicality wise, right now, I used to show, like before I used to show them like Figma mocks and wireframes, right? Right now, me as a designer can use Cursor AI and show them an actual website and get directions from them, right? We're already there. So I feel like we're already moving from one size fits all kind of messaging or experiences to adapt like and meet where people are, right? So I feel like instead of like forcing people to learn systems, systems will now learn to communicate with people. That's where we are currently, I believe. And but I also think that human element will matter even more now, because there's so much automation around us. Like everything is just given to us in a silver plate, right? To do like I think like the tone around like trust, empathy, transparency, like everybody spoke about, will be the differentiators. So the organizations that will succeed will be actually the ones who don't just personalize content, but personalize care, personalize empathy, affection, making people more seen and understood, and not just served or like, like that's it. That's what I think, basically.
So well said. And a perfect capstone here to the conversation. I see that Risha has asked about connecting with all of you. That was how I was going to bring this part to the close before handing it over to Chiquita for our final thoughts. All of the panelists here are happy to connect on LinkedIn. I believe we're going to drop those into the chat momentarily. So please reach out to them. Reference the fact that you were able to attend today. If you see this video asynchronously, still feel free to go forward and find all 4 of these wonderful thinkers and doers and communicators on LinkedIn. They are all readily available. Thank you for putting that into the chat, Lynn. I'm so thrilled that we could have this conversation. This, again, is why I find these alumni spotlights so provocative, so thoughtful, so deepening in terms of my understanding of a particular slice of communication. So I extend my gratitude to the 4 of you, but I particularly extend my gratitude to Chiquita for the idea, for her incredible able facilitation. And Chiquita, I now turn it over to you to close us out at the top of the hour with any last thoughts, and thank everyone for being part of this, both attendees and panelists. Chiquita, over to you.
Yeah, thank you so much, Anita. I am very shocked and so thankful that you guys shared you guys' answers and things like that from you guys' career perspective and also personal. For me, I want to continue to reiterate the importance of trust when it comes to communicating and when it comes to being transparent, because that is going to be the differentiator as the world continues to change with the power of AI and the development of tech. So I just want to thank everyone again for being here. Continue to live with you guys' true selves as you guys enter new career changes and things like that. Thank you, Lynn Lee, for your work as the Zoom DJ and dropping things into the chat. And again, I'm gonna reiterate what Anita said. You can review this conversation on our Comly YouTube page. And it was an engaging conversation. And again, I appreciate every single person that joined here from my community. And so far, I'm just super excited and thank you. Have a good day and a good lunch hour.
Thank you all so much, Chiquita. Thank you so much. And Jennifer, Alina, Yirong, and Devika, we're just so thrilled to have had this conversation. And thanks to everybody who joined. Thanks so much.
Bye-bye.
Bye-bye.